SubQ stands for subcutaneous administration. And so this is a way of giving a medication where a small needle is injected under the skin, that's the subcutaneous fat, and then this medication is absorbed throughout all the fatty tissue, ultimately absorbed into the bloodstream and goes through the body, just killing those cancer cells. And so, why is this a good thing for our patients? It's because we bypass the traditional IV administration. When patients get IV, they have to be hooked up to an IV catheter. It's mixed with fluids and then injected into the bloodstream or the catheter over several different hours according to the treatment regimen or the medication. With SubQ, we really minimize the time that a patient has to be on a chair because you don't need all that mixing and you don't need all that slow infusion. Patients instead get the medication directly injected in your skin, and then it takes about 3 to 5 minutes and then they're out. So the good thing about this is that patients not only have satisfaction and quality of life, but also opens up the chair for more patients to be able to receive treatment.
I was 37 years old when I was diagnosed with lung cancer. It was a shock to my family and to myself. I went on to treatment, which included surgery, chemotherapy, and targeted therapy. It was during my chemotherapy regimen that I was introduced to SubQ as a method of getting my medication. Now, I already knew about SubQ because I had been a nurse long before I got lung cancer. So I had administered SubQ injections. It was insulin or allergy shots or maybe blood thinners. SubQ has been around for a long time, so I was comfortable with getting an injection SubQ. What I didn't realize was just how much time that would save me. I was spending hours in the infusion chair. I was getting fluids and having to work out logistics like childcare and transportation. So even getting 30 minutes back felt like a win for me. I didn't have to worry about accessing veins and some of the other considerations with IV therapy. I encourage any patient to ask their doctor about SubQ therapy to see if it's right for them and to check out lcfamerica.org for more information.